Welcome, Rachel. I know we didn't get to do this live on Facebook because Facebook seems to be a little bit different right now or these days. I can't go live with more than myself. So, we're recording this and we're going to play this back on the Facebook group. So to all you ladies who are watching the replay, this is Rachel Varga. She is an RN and is board certified aesthetic nurse specialist. She's been doing this work since 2011. She is an international clinical trainer, speaker, podcaster, and academically published, award-winning author in the field of plastic and aesthetic nursing. So through education on skincare, skin and laser rejuvenation, non-surgical solutions, and healing lifestyle practices, Rachel helps inspire others with her unique toolkit to navigate and strategize aging impossibly well. I love that.
Thanks for having me, Sarah. It's a pleasure to be here.
Of course. So happy to have you. And so the things that we're going to talk about in our group, I want to focus on non-toxic, safer options, ways that women can reverse the signs of aging, age well, moving forward, and just, I guess, aging gracefully and aging well from the inside out, like you teach.
Mm-hmm, mm-hmm.
So how do you want to start?
Well, why don't we just start with the basics? Before we started recording this interview, we were talking about, well, how do we keep things minimalistic, right? Well, you can keep your skincare routine pretty minimal with just following a couple key basic steps. So cleansing the skin morning and night, moisturizing morning and night, sunscreen every day, and exfoliation a couple of times a week. Mm-hmm. But the trick is using the right things for your skin type. So whether you're dry, you're acne prone, rosacea, melasma, there's some nuances to know about which actives could be helpful for you. And you've been able to keep things pretty minimal. I mean, look at you. Your skin looks awesome. You're glowing. And what did you do for your skin before this call? You kept it pretty minimal, you said, right?
Yeah, just a little tinted moisturizer and blush, and that was it. But yeah, I've got your help also.
Yeah. And it's great when you just start using the right products. So I work with what's called medical grade skincare. So it's basically formulated by a chemist, and they seek out active ingredients like vitamin C, hyaluronic acid, and peptides. Mm-hmm. And then they put it in a final formula and actually test the final formula, not just making blanket claims on what vitamin C is known to do, or vitamin E or A is known to do, or hyaluronic acid. It's actually, so you're working with products that do actually focus on research and development as opposed to marketing, which is what you're going to find in places like Sephora and other sort of beauty counter type pharmacy places. So it's a bit different.
Yeah, definitely. And I definitely noticed a difference in how the products work that you recommended to me, and how my skin quality and how it's just a little bit more glowy, I would say. Like my skin texture and tone is really good. And so, yeah, you can definitely tell a difference for sure.
Yeah, it's interesting when I go and try and use a different product that maybe isn't medical grade, but it's this new thing. Okay, Rachel, you got to try it out. I can actually feel the difference in the quality even when I put it on my hand. There was one brand that was made by a local physician. I put it on my hand. I'm like, oh, this feels like straight up propylene glycol. And sure enough, I went to the back of the bottle and it was like the first ingredient after water.
Oh my goodness. Oh God.
And it's like, what is the active in that, right? So when you're using good products, it's got like a smattering of all these active ingredients. Mm-hmm. So, instead of having to layer, I did a consultation for a lovely woman yesterday from San Diego. And she was putting like 6 serums on, like one vitamin C serum, then a vitamin E serum, then a hyaluronic acid. And it's like, well, if you're layering all these things, there's probably going to be some incompatibility or, interactions with all those products. So just, use one thing, like for instance, super serum. It's got a whole bunch of awesome ingredients in it. Mm-hmm. So just keeping it simple, but just going where the science is and products backed by research.
Yeah. So a lot of the women in my Facebook group, in the breast implant illness Facebook group, do struggle with skin issues. And I think a lot of that has to do with the internal environment in the body that we are personally struggling with, those of us who are sick. And I think it's a big reflection of, the ability to detox properly and um, liver health oftentimes, sometimes gut health. So what kinds of things do you recommend as far as internally to help encourage healthy skin and aging, really well?
Well, you kind of started to go there. The different detoxing pathways is something that's really important. And you're going to be able to talk about this probably to an even deeper extent than I can, because you work with labs and things like that to help your clients along. But it's really important to understand your specific constitution
Mhm.
and which pathways may be turned on or off and which lifestyle tweaks that you can make to open them back up so that you can detox. But absolutely, if your body's full of toxins, you're not going to be, you won't have that glow. You're not going to have that level of radiance. And actually, the same goes with negative thoughts as well. This might sound pretty cliche, but it's a thing, right? The yoga
Absolutely.
glow, all that. I mean, it is a thing. So the more you can make that internal environment just more beautiful, happy and healthy and vibrant and positive and loving and giving yourself grace, you and your others grace and kindness, it actually does make a difference. I see this in patients that are going through a tough time or they've really been able to focus on their self-care. They do, one could be perceived as being younger, but someone who's 20 years older who's doing all that inner work, they can actually be perceived as looking more beautiful, radiant, vibrant when I see them, and they have a few more wrinkles and fine lines, but it's that inner aspect's really important.
Yeah, I absolutely agree. I think, even just negative thoughts, like you were saying, or worry or day-to-day stress in our lives can put us in a state of chronic fight or flight, and all of our resources go to just merely surviving rather than flourishing and focusing on more of those rest and digest qualities in our bodies. And so I would say, I'm always telling people, even just your negative thoughts can actually put you in that state of fight or flight. And so all of your resources just get totally just redirected to a different place. And so that can have a really serious impact on how you look too, because you're just totally draining your resources.
Mm-hmm.
So yeah,
I'm fighting inflammation as
yeah,
opposed to regeneration.
right, right.
It's actually something that's really simple. It and it's difficult until you're aware of it. But when you start to become aware of how to give your body and the environment that your body is in the best chance for being happy and healthy, you're going to be more beautiful. It really goes hand in hand. And so I'm happy to talk about rejuvenation procedures if you
Yeah,
want.
let's do that.
Okay, great. So there are a ton of ways to rejuvenate the skin, both on a cellular level, making collagen, basically telling the skin cells to be happy and healthy. And that can actually really be achieved through a lot of different laser technologies. There's a lot of garbage technologies out there, but then there's some really great lasers. So some that target pigmentation, rosacea, red acne scars, and others that target resurfacing, pore size, fine lines, wrinkles, giving that glassy skin. So to find out sort of which option could be right for your specific constitution and skin type and your needs, then having a consultation with a provider is really key. But you don't really have to be scared about laser treatments because back in the day, people would be red for like 10, 20 days. Now you can maybe only be red for like 3 days. It's pretty
Mhm.
cool where the technology is gone. You don't have to look like Samantha from Sex and the City. Um,
I remember that episode.
it's awesome. I actually use that as a YouTube thumbnail talking about chemical peels. Chemical peels can also be a really great affordable option. They're about, 125 to 175, and they can contain things like lactic acid, salicylic acid, resorcinol, glycolic acid, and they can help to gently exfoliate the top layer of the skin off. And they can also stimulate collagen and a few other things. And you might just get some minor flaking with it. Sometimes you'll flake a lot. Sometimes you'll just flake a little bit, depending on the type of peel and concentration. But those are great options that the chemical peels, hydrofacials, things like that are pretty cost effective. And then the lasers are going to be a little bit more expensive, but they'll kind of get your results a little bit faster, if you will, than if you were to just stick with like good medical grade skincare and then like hydrofacials or chemical peels.
Gotcha. So if we're going to talk, can we talk about the difference between some of those options that you talked about, like what kind of benefits or what kind of effect you're going to achieve, like through something like a hydrofacial versus, I don't know, uh,
Like a chemical
I,
peel.
yeah, go for
Yeah.
it.
Yeah, yeah. The hydrofacial is kind of like a wet vac for the face. So it uses vacuum to pull out dirt, oil, debris from the pores, and then it infuses different solutions into the skin. So it's kind of great if you feel like your skin needs just a little bit of like a reset, and say you're feeling a little bit congested. It's that time of the month for me. So I have a few things that have started to pop up. So guess what I'm going to be doing tomorrow over my lunch break? I'm going to be giving myself a little hydrofacial and resetting my skin. So for acne prone people, those are incredible because they're just pulling out impurities, and then they're infusing cleansing solutions, anti-inflammatory solutions into the skin. And then it makes that redness, that post-inflammatory hyperpigmentation go away a little bit faster, which is awesome. And pretty well everybody can have them.
Yeah, I'm actually scheduled to have one tomorrow.
Oh, perfect. Yeah.
Yeah, very excited.
Yeah, and you'll look totally fine after. Your results, you'll probably notice actually about a week to 3 weeks later.
Oh, really? That long?
Mm. Yeah.
Hmm. Nice.
Yeah.
So let's talk a little bit about, because I know, people who, this is a generalization, but, it's just a fact of life. People who are concerned with their body appearance and have placed breast implants also are usually concerned about other things about their body as well, like their face. And so a lot of people have had different injections and like or is it a filler or a Botox or things like that. What
Mhm.
are your thoughts about Botox? And this is a hot topic right now, and it's a little bit controversial, but
Well, I'm happy to talk about this. I wrote a paper last year, and in my paper, it's called Providing Optimal Rejuvenation to the Periocular Area Using Advanced Techniques. So you can just search my name on PubMed, things like that, Rachel Varga. So in my paper, I have a chart, and it has the molecular weight of all of the different neuromodulators on the market. There's a number of them. So some of the main ones, and this is just common knowledge: Botox, Xeomin, Dysport. There's a few others that have just come out. And one thing that they all have is an active neuromodulator. It's the active component that tells the nerve to, not send as much of a signal to the muscles locally. And the difference between some of these products, you can actually just refer to my chart. Some of them have what's called complexing proteins, and some of them don't. And the complexing proteins are actually, this is not new information. There's multiple studies on this from about 2012 onwards of an autoimmune response from the complexing proteins in some individuals. And basically what that's causing is actually just a non-response over time to the active component. So think of like the jelly bean sitting inside of a tennis ball. The jelly bean is the active component, and the tennis ball is representing all the proteins around it that actually, as soon as you add normal saline to that little vial, the active component and the proteins just disassociate. So it's not adding to stability to product or anything like that. So do you want to know what I choose to use right now?
yeah.
I just use the one that doesn't have any proteins in it, no complexing proteins. So it's just the active neuromodulator component. So there are cleaner options out there. Botox is like Kleenex, right? So there's many different types of brands out there. But one thing I will say is that you should never consider having rejuvenation or elective procedures in general if you're not feeling very good. Say you already have an autoimmune disorder, say you're fighting the cold or the flu, and you just don't feel great. Maybe you've just been doing a sprint and you just kind of need to, give yourself a little bit of grace. You might just want to mute. Perfect. There we go. Hi, Sandra. Hey, Sandra. Thanks for joining us. When you're considering getting rejuvenation procedures, only do them when you're feeling well. That's kind of the bottom line. And, don't push yourself to feel unwell in the name of, trying to smooth out a couple fine lines and wrinkles. Something to think about, right?
Yeah, absolutely. And I think, personally, from my perspective, I feel like if you have a history of any autoimmune conditions at all, you just should avoid it altogether and
Yeah,
avoid anything being placed into your body that doesn't belong there. Um,
I
and
totally agree with you.
and then I think I would go, personally, I would probably go a step further and just say it's probably not a good idea in general, but you can't, everyone is going to make their own decision. And I respect everyone's decision and choice. And so if you're going to do something like that, just make sure you're educated about it and you know all the risks, and you go in informed,
Yeah.
you know what you're getting into.
Yeah. So always meeting with your healthcare provider and asking them the questions. I can't really make blanket claims as a registered nurse, but I can speak to literature and research that's already out there. So there are some cleaner versions
Mhm.
of facial injectables that soften the motion of, the nerve and the muscle.
Mhm.
So there's options now, which is great, and there has been for actually well over 10 years. But there's a lot of, totally non-toxic ways to stimulate the skin and collagen, and that's with the laser technology. So if you say are a little bit immunocompromised and you don't want to, put anything in your face or body that is potentially going to cause harm, then go for lasers, right? That's a great way to reduce pigmentation, brown spots, redness, acne scars, like red acne scars. And then there's some laser resurfacing options that I talked about a little bit earlier. So we're living in a really cool time that we have options.
Yeah, yeah. Yeah, that's really exciting too. So I have never even gone to a med spa. This will be my first time tomorrow. But I think it's really intriguing and I'm excited to learn more about it. And lasers aren't something where I'm going to start off with something really, simple, but we'll see. I mean, what is your favorite laser treatment
I
for?
love being asked those. So it's different for everybody. So you should always meet with the provider to figure out sort of which options are right for your goals and skin type. But for me, one of my favorite laser treatments is an IPL, or intense pulse light treatment. And there's a couple of really cool Stanford studies out there that are talking about the BBL in particular. It's the company name is Cyton, and the laser is called BBL. And it's a type of IPL. It's one of the more advanced ones on the market right now, but it has research to back up their claims, which is great. So it can actually change gene expression of the skin and
Hmm.
switch different genes. I would talk about this in my Bulletproof Radio interview with Dave Asprey. It's episode 668. That's a really sweet episode to tune into. And yeah, when we hit 50, certain genes are turned on and off in the skin as per the Stanford study. You can just Google it, BBL Stanford study, you'll find it. And then in a 30-year-old, it's like that gene expression is opposite from a 50 and a 30-year-old. So with this particular laser technology, we can basically make the 50-year-old skin cells and how the genetic behavior is going on to look like that of a 30-year-old. It's
Hmm.
really, really cool what we can do now. And imagine the future applications for just like our health and body in general with technology that has the ability to do that. So I like getting the IPLs a couple times a year just to keep my skin clear. It's like taking a magic eraser to the skin for browns and reds.
Wow, that's amazing. Absolutely amazing that something is out there that can do that. That's
Yep.
not like a drug or something you have to inject. So really, really cool.
Light energy.
Light
Sweet.
energy. Yeah, there's so much research right now on different types of light energy too. So yeah, very powerful in many different forms.
Hmm.
Um, oh, there's another person joining. Hi,
Hi,
Mary.
Mary.
Gonna see if I can mute. Oh, there we go. Mute. Okay, so what kinds of things in skincare do you think it's important to, as far as ingredients, to avoid?
Oh, yeah, I love this one. So you want to avoid parabens, phthalates, sulfates, artificial dyes, fragrances, and no testing on animals. Chemicals are not bad, right? Water and air, you've probably heard of those. We kind of need them all the time. They are chemicals, right? So when oxygen, hydrogen come together, it's a chemical compound, right? So when you see, I talk about this in my ebook and my course, Unlocking Your Vitality, there's a ton of marketing ploys out there. So whether it's green, it's all natural, it's chemical free, that means absolutely nothing. What matters is paraben free, phthalate free, artificial dyes, fragrances free, and not tested on animals. Those are really the big ones that you want to avoid in your skincare.
Mm-hmm. Yeah, and I was really pleasantly surprised actually when I started using the skincare that you recommended to me, because I was expecting, and I know it was phthalate free and all of that, but I was expecting it to still smell, and it has no smell, which is so unusual. And I was really happy about it,
Yeah.
because I don't like to wear things that have a lot of smell, because it just makes me think, unless it's like an essential oil, it just makes me
Mhm.
think I'm adding to my toxic burden.
Absolutely, because when you smell it, there's probably something there, unless it's
The
like
phthalate,
a
yeah.
beautiful essential oil. But yeah, most people do have sensitivities to smells. I
Mm-hmm.
do as well. So I actually hate using products that are heavily scented also.
Mm-hmm.
Because
Yeah.
what you talked about with toxic love, that's just it, right? So when you say use like one product like this one that's got your hyaluronic acid, peptides, and all of that kind of like smashed into one product, you don't have to layer all these 4 or 5 things that have different stabilizing ingredients for that, say for example, vitamin C, so that it doesn't turn into a free radical and go rancid. It's just a matter of using slicker formulas. So medical grade is definitely, I think, where it's at. I've tried to go like the all natural route, 5
Mhm.
ingredients, essential oils, the oil cleanser, moisturizers. I just find they don't really cut it, especially when it comes to anti-aging. So when you work with products that do take the time to hire really good chemists and do research on their actual formulation, you're going to be getting results, but you're also going to be getting access to a cleaner product.
Yeah, yeah, I agree. And I've tried, you should see my my cabinet in my bathroom is just like a skincare graveyard. I mean, there's so much skincare in my bathroom, and it's all the natural lines that I've tried over the years. And I just kept buying new ones every few months, because I kept thinking, this is not working. This is not working. I don't like it. Like, no, no, no. I do have a couple of natural lines that I really do like, but yeah, I mean, I'm always looking for something new and something, a little bit of a change, because I think our body, our skin gets used to, kind of just like our hair gets used to like the shampoos and products that we use.
Yeah, so in the skin, there's different signaling pathways, right? So if you're only ever using one product, your skin cell signaling pathways are going to kind of get lazy. So sometimes it's actually not a bad idea to mix up your active, once or twice a week, or at least, maybe once or twice a year. But the trick is, what I do for my patients is I sift through, I work with about 10 different medical grade brands. Every brand has duds and superstars. I'll be the first to tell you that. But what's unique is that I see what people keep coming back for, especially after nearly 10 years of the industry, working with thousands of patients. I see what they keep coming back for in the clinic. I see what is giving results. And
Mhm.
that's what I would like to recommend. I don't just like to recommend what's hot, what's trendy, what's on sale, what this cute little kit is. That stuff doesn't matter. That's actually why you won't really see me promoting that stuff on my social. It's like, okay, these are the basics that I just see work really well with people with this skin type. And then what you do is you just reevaluate every couple of months. If your skin's feeling a little dull or dry, have someone like me to ask you, right? As opposed to trying to go to the beauty counter and ask the salesperson or the makeup artist that's working, at the store where you get all your toxic products.
Yeah.
It's like, what do they really know? Like, they're working behind the counter. They're not working with people using photography and
Yeah.
assessing changes over years. So it's kind of just a different,
It's retail, it's just a retail
yeah,
position.
yeah.
Um, I remember, so before I switched over to what you have recommended to me, I was oil cleansing. And I oil cleansed for many, probably 2 or 3 years. And I thought it was like the best of the best. Like, this is exactly what skin needs, because it's like the same, your skin is made of lipids. And I'm thinking, well, okay, perfect. We'll do something, that's very similar to what your skin is made of, to prevent your skin from drying out and all of that, stripping your skin. So do water-based cleansers strip the oils from your skin?
What
That's
matters is if they're
about
pH balanced.
pH balance. So that's the more important issue.
Yes, that's the more important issue. Pretty much every product has water in it.
Yeah. Yeah.
Right? Personally, oil cleansers make me break out, and I think it's a bit of a trend. Oil cleansers and oils aren't really big in medical grade skincare
Mhm.
because I think what the companies and also, myself as providers have realized is that they just don't necessarily perform as well. Like I tried to love oil-based products and it just didn't quite work for my skin type because I'm
No.
really acne prone, right?
Yeah, and I actually am too, and not as much now, but I when I ran out of the water-based cleanser that I was using from you, I went back to my oil-based cleanser, and immediately within a week I had like a little like deep cyst under my skin.
Yeah. Yeah.
And I haven't had anything like that in probably a couple of years. So
Yeah, so what
yeah.
was happening, your skin was responding well to what's called the salicylic acid in the cleanser, which can help to kind of suppress an over oil production in the skin. So it's
Mhm.
like this fine line,
Yeah.
right?
Yeah.
But I will say, like the super clean, locally handcrafted products for your household cleaning and
Mhm.
your body care, awesome. But when it comes to the face, neck, chest, and hands, I do recommend, products with a little bit more emphasis on research and not anti-aging, but proactive aging. Because we don't have to be scared of it, of aging. It's just a matter of doing it smarter and having people to help you out. It's like for you, helping people navigate their breast implant illness and getting back on track with their health and reducing their toxic load. I help people
Yeah.
with the skin. I help them kind of come up with their rejuvenation treatment plan for, the next couple of years. It's pretty cool.
Yeah. Yeah. Very cool. All right. I think I've asked all the questions I could think of. Do you have anything else you think would be important to mention or talk about?
Okay.
And then I want to bring up your book and your course too.
I'll share some questions I get all the time on social.
Okay.
Where do I buy a roller? And should I
Ah.
do gua sha for my face? All the time, probably 2-3 times a day. So if you want to get a roller, don't buy it on Amazon. If you want to know why, watch the documentary called Broken on Netflix. It's going to be an eye opener. Never buy anything for, household food, beauty, supplements ever on Amazon or eBay. That video will explain why the counterfeit beauty industry
Yeah.
is crazy right now. So get your roller from physician, nurse, someone who understands actually how to guide you on microneedling at home, because you don't want those little on the roller, you don't want them to be blades, and you don't want those little needles to actually come off in your face or give you
Mm.
exposure to heavy metals. Trust me, this happens.
Wow.
And then for gua sha for the face, I just find that that's a really great way to kind of get lymphatic drainage to the face. But in terms of
Mhm.
studies and efficacy, I've yet to come across anything to support the actual skin benefits to kind of gua sha. But lymphatic drainage, you're going to get that through, your cleansing and your moisturizing at home in your daily routine. Do you need to spend $50 to $60 on a jade roller to do that? Probably not. So there's a lot of gimmicks out there. So I
And
just
the other thing I wonder about too is that you always see people rolling upward because probably gravity, they're trying to fight the gravity, right? But you want your lymph to drain down, not up.
yes, especially coming out this way. Yeah, I mean, gravity always wins, right? We lose bone, we lose fat, we lose soft tissue, collagen, elastin in the skin. But I mean, massaging the skin and these upward strokes is just like, I don't understand the science of it.
Yeah, I don't
Don't
quite
mess
get
around.
it. I don't quite get it either.
Yeah.
So one more question. What are your thoughts about the vampire facial? Because that's obviously really popular right now.
Okay. Go on your Wikipedia, put in PRP. The first page on Wikipedia says basically in a nutshell, the results of PRP are inconclusive.
Mm-hmm.
Uh, what I recommend, instead of spending $250 plus on someone else to do needling on your face, spend $250, get your own medical grade roller that should last you 2 years if it's a really good one, not just a 10-use one that you'll find online, and serums like copper peptide, vitamin serum that are proven to be effective with microneedling. That's going to last you. You're going to get multiple treatments out of it. So from a cost benefit perspective, that is something that's great to do at home, as opposed to spending thousands in a clinic for, basically people do microneedling and PRP to help with things like pore size, acne scarring, collagen. I think that lasers do a better job of it.
Okay. Good to know.
Yeah.
All right. So why don't you tell us about your course that you have and your ebook that you just finished recently, that you have available now to the public?
Yeah, I just really like helping people kind of figure out what works, what doesn't work. I basically work with people all over the world. I practice on Vancouver Island in a really cool clinic where I perform these treatments, but I also meet with people online during a virtual consult, which you can book with me at rachelvarga.ca. I'm extending to all of you guys in Sarah's lovely group a promo code for everything. Sarah Felipe 15 is going to get you 15% off my virtual consult, where I spend an hour going through your specific facial goals and coming up with a plan for you, product and procedure wise. And then my ebook is a great resource. It's like $14.99. It's awesome. I give my best secrets out there. And then my masterclass, which is like a 30+ video series, which I'm there kind of holding your hand through all these different topics. I'd say if you're really wanting to figure out what's right for you and kind of bypass that med spa bias, a 15-minute consult approach, and spend an hour with like an expert like myself, it's a great option, and I'm really happy to share that with your group. Yeah, so just rachelvarga.ca.
Cool. That's really exciting. I know I found a lot of value from meeting with you, and so hopefully some of these other ladies will be interested in that as well. I know that people are always asking me, like, what do you recommend for skincare, or, cleaning products, or, what's your favorite air purifier? What's your favorite coffee? Like, I get, you can think of it. Someone's asked me.
Yeah.
So
let's just keep helping people and sharing our knowledge and expertise. And this is a really cool way to do that. Thanks,
yeah.
Internet.
Yeah, right. Yeah. Makes it super easy to share with everyone. Yep.
Yeah.
All right. So we'll put a link to your ebook and course and where to book a call with you in the comments when I post this in Facebook. And I'll put obviously my my discount code there for people to use as well if they book a call with you. And yeah, super exciting. I highly encourage you all to take advantage of Rachel. She is a wealth of knowledge, and I just really appreciate you.
Thank you, Sarah. I appreciate you too. And I'm really grateful for you helping women kind of get over their toxic burden after different procedures like breast implants. It's very important work, and having the community that you've helped us facilitate to help give other women the strength to go through this is very profound. So I'm really grateful for you for doing this work as well.
Oh, thank you. All right.
All right. Bye, everyone.
Bye.
Bye.